great honor to introduce the next talk now. Our past president, Larry Wallace. He's a doctor of optometry and has a PhD in ocular phototherapy. He has practiced for over 35 years in Ithaca, New York, in the United States. He has served as the president, as I just said, of the International Light Association and as the president and education director for the College of Syntonic Optometry, an organization that is dedicated to education and research in the field of light and color therapy. He has invented and patented the first microcurrent device to treat eye disease and has published numerous articles and research on phototherapy and rehabilitative optometry, and is also certified low vision specialist in the state of New York and offers alternative care for eye disease, and has worked extensively in the field of optometric neurorehabilitation, postural restoration and treatment of head trauma and brain injury. And he will now share with us his thoughts and beliefs about light reflections. Thank you.
Thank you, Ken, very much. So I'm going to be talking more in a personal vein and kind of reflections about what's happened the last, probably more like 35 years, and share some of my ideas, some of my insights, and some of the things that we have tried to accomplish. I too was in San Francisco in the mid-70s, was working at Kaiser, a big HMO, because I believed in preventive health care, which was not happening there. And I looked in a Big Sur Essalon catalog, and I saw an optometrist named Ray Gottlieb teaching Bates in Northern California, and I had written my senior paper on Bates in optometry school. I called him up immediately, found him, and he said, "Oh, I'm doing a workshop this weekend. What are you into?" And I said, "I'm into vision and consciousness." And he said, "Oh, come to my office." And I was there 2 hours, and he hired me. I left Kaiser, and Ray exposed me to all kinds of alternative eye care. But the one that grabbed me so hard was syntonics. I saw that they were using colored light into the eye to correct vision problems and help health, and I just was, it just drew me so strongly. So I became very involved in that organization. And back in the 70s, I already knew somewhat about light. I knew about John Ott and full spectrum lighting and things like that. And when we started in Syntonics, Jacob Lieberman was the president at that point, and actually soon thereafter, very soon after. And Jacob, we started talking about how can we prove more about light. And of course, what Syntonics already had going for it was that we knew the energetic pathways of light to the brain, the neurohypothalamic pathways that light went to the hypothalamus, to the pineal pituitary. It regulated the rhythms, it regulated the autonomic nervous system, the endocrine system. So we knew all these neurological things, but yet we would be like magic. We'd shine light in people's eyes, and their perception would change, and their visual fields would open, and they would change in many different ways. And we said, well, this is so profound, we need to know more about how this could possibly happen. And so that's been my trip, my interest all these years, is to try to understand light in many different ways. So the early years, we had the people from NIH there, National Institute of Health, who were doing research in circadian rhythms, and we brought the leaders there, Norm Rosenthal, Manning Louis, George Brainerd, Russell Ryder, all these researchers on light and circadian rhythms in the pineal gland. And it was all really interesting, but it was more all about treating seasonal affective disorder, and it was so hard to tie it to, some of the work that we were doing. But anyway, it was still bringing light into the scientific realm where light was accepted as a treatment modality, and so we weren't the only crazy people out there shining. Syntonics had been around already since the 1940s, so we were around a long time and had a long clinical track record, but still the science wasn't there to really validate what we were doing. So it became, our goal to continually to further that. Now, right in the early 90s, this is all through the 80s, we were bringing these researchers in. And then around 1990, John Downing furthered our work by inventing the Lumitron, which was the Photron, it was called at that time, and he worked with Ernie Baker later, who renamed it the Lumitron, and the instrument kept evolving. But John was the first one to talk about really taking different light sources. He used the same colored filters that we use in syntonics, but tied it into a plasma light source in order to simulate sunlight, and then you added flicker to the treatment. So it opened up our treatment modalities. But and then it wasn't there very long after. This was around 1990. I became director of education for the college and also the vice president. And I wanted to start to bring in other professions. I felt that we're not going to find the answers unless we bring in lots of different professions. And so we opened the doors to all kinds of other therapists, psychotherapists and body workers and naturopaths and anybody that wanted to do with light, and especially acupuncturists, and lots of different people started coming to our conference. And I was actually brought in almost all the speakers, so I would choose ones that would further our ideas at the time. And I started treating eye diseases with light that nobody had really done that I knew of. And we were getting results. We were using red light for one retinitis pigmentosa, using blue light, green light for macular degeneration, and getting really good results. I published papers on it. And I thought at the same time, well, maybe there's other forms of energy that the body is just as receptive to, but is maybe more physical, and those would be low frequencies, like a microcurrent. So I teamed with an engineer, we invented a microcurrent device, and we started treating with low levels of electromagnetic energy, like very low frequencies, and the lower vibration. We're getting really good results. We patented, we did many studies, and we're still, almost 20 years later, still trying to get it through the FDA. It's been a long journey. But it's been very successful. And it's kind of opened my eyes up to lots of other modalities as well. We had people like Stephen Vasquez, who did brief strobic psychotherapy, come, and he would have you look at colored lights, and then he would do talk therapy. And every time the people looked at the colored lights, he would change it according to where they went with their emotional release. And I mean, he was treating bipolar, he was treating multi-personality disorders. I mean, incredible kinds of psychological disturbances with light that would accelerate the treatment. He would have people done in weeks that people would be under therapy for years for without the light. So the psychologists were coming in, and we had we even did a study with psychologists doing EEG patterns and certain kinds of psychological performances using syntonics, and we had results. But again, didn't really explain the power of the light, just that we had these effects, and so we just kept looking. So I started thinking, being really drawn to physics, and I loved physics in college, and so I was looking at biophysics. And we had a doctor come named Glenn Swarthout, who talked about biophysics as the foundation of life processes. And he talked about biofield communications and about the electromagnetic terrain that allows us to accept certain frequencies and certain kinds of information and energy. And that opened up more questions than it did answers, but it was very exciting to hear about all these things that are going on in physics. So it wasn't. So then I started looking for physicists, but I came across what was called a quantum biologist named Bruce Lipton, and I asked Bruce to come to our conference, and he talked about the biology of consciousness, and it just blew us away, because here was a hardcore Stanford scientist, PhD there, showing how you could use different kinds of energy to change the DNA and the way the amino acids would cycle through, and you could actually change the now it's called epigenetics, but back then he could show how DNA could be changed with electromagnetic energy, including light and thoughts even, and emotional training. And so he showed that we are this constantly interfacing with the universe in a way we're in constant change, and he could show it on a biological level, and that was extremely exciting. And we thought, wow, while we're on it, we're really getting closer to starting to validate a lot of the things that are happening scientifically. So at the same time, I became really interested in other models, such as acupuncture, and I brought in different people that were doing color puncture. We brought in Helga Prosak, Sandra St. Clair, naturopath, Mark Grossman, a number of different, we brought in esogetic medicine, which is the Mandel school in the United States, and we tried to bring in all these people. We saw how, yes, color and acupuncture models, Chinese medicine, Ayurvedic medicine paralleled beautifully with what we did. But there's a deep philosophy attached to these kinds of treatment modalities that were definitely in sync with us, but at the same time didn't validate us in a scientific way. It just showed that obviously this stuff's been around for thousands of years and we're just another part of it. So it certainly validates it in one way, but not in terms of the scientific community. So another scientist we found who was doing light therapy, his name is Dan Oren, and he was doing research on the hormones when you shine light into the blood supply. And they were treating jet lag. And so we brought in this Dan Oren. He did something called he called it humoral phototransduction. So they would put light in the back of your knees, and at the same time that measure what happened to all the hormones in the blood. And they found all these changes using certain frequencies of light that could treat jet lag and move and totally shift the circadian rhythms. But I think the one that did color puncture that really excited me the most was Nishant Matthews, because in his Samitsati therapy, he didn't even have to touch the points of the body to get all these changes. And he would work off the body, off different areas to do his psychotherapy, his emotional healing, his physical healing. And of course he has a school, he's had a school at the time to teach Samitsati that he developed over years of therapy. And now Jan and Vilma are carrying that on and right as we're here this weekend. So, but Nishant was, one of the things that I think was also very exciting about his work is that it showed the power of the inner light, because he could hold the light off the body and have tremendous transformations occurring in people. And you know that it's not the physical light because he's holding it like 2 or 3 feet from their body. I mean, it may be affecting their aura, affecting them in certain kinds of energetic levels. But at the same time, I think that I could see that the people look at the light and they visualize the light, and it's that power of their own thought, their power of bringing that light into themselves that had tremendous transformative power. So that was very exciting to see his work. And we've had him back, I think, 2 or 3 times since then. So we had all the Chinese medicine, and that was great. We brought in a scientist named Beverly Rubik, who was very big in the energy medicine field. And it was that point I was kind of moving away from the biophysics into it's all energy medicine. And so she was one of the leading thought leaders in energy medicine. And so she came and talked to us about the fundamentals of energy medicine and the future of healing, and she showed how electromagnetics could be used to regenerate tissues and change all kinds of physical matter in the body. And that was exciting. And I think that what I took from her that was very important was that she said, when we're using subtle energy, it's all slow. You have to do it, you give the stimulus, and you have to wait for the response, and then you reintroduce the stimulus. And as we heard yesterday, in the chromatotherapy, how he treats and then he waits days and days and days, and it's a cascade of events that lead to change. And so in energy medicine, we're trying to change the person, balance them, have changes, but it's a slower process and it's more gentle, and it's in remembering that. We have to remember that patience to bring to our work. So shortly thereafter, we had a conference where Sarah Cobb was introducing using ultraviolet and infrared light to treat all kinds of eye conditions, and It was right about that time that I met Ed Condrat, who was here. He was also doing microcurrent therapy, had a great book about it, was treating lots of patients, and as an ophthalmologist, he validated my work in a way that hadn't been done before, finding somebody else that was, with all his knowledge, saying yes, microcurrent and color. Now he was learning to add color to it, and that's what we were doing too, color and microcurrent, very powerful. And then another groundbreaker, and he's I'm here right now, is James Oshman, and scientific basis in energy medicine. I thought, well, this is it. We're going to get the validation. Now we're going to understand the pathways in a way we never have before. And that was all true. And, Jim came and spoke to us and talked all about the liquid crystal matrix, the transmission through the connective tissue, you could see it going through the perivascular tissue, that instantaneously light was going throughout our whole body, and that there were all these communication systems, much of which were based on biophotons. And of course, when we were in Arbonne, way back at the beginning, Fritz Popp was there doing research on biophotons, and they were doing photo counting of the biophotons that came off the body, and finding that where there were deficiencies in biophotons, that there were disease processes going on. And you could give a therapy, and then if the biophoton count went down, the body was accepting the light and wasn't rejecting it or giving it off as a way of trying to regenerate itself. And you could tell the efficacy of therapies by that, and it was unfortunate that that university closed, and then he went off and he's done this research outside of it. But we were hooked up with him at one point. And then at the same time, Anadi showed up, and he would, with his sensora, and here it was light and sound and vibration all together. And Nadi would come every year to Syntonics and bring this huge thing. It was like as big as this screen. They would have it shipped wherever we were with all of his equipment, and this giant screen and all the amplifiers and things. And he brought it every year. It was for a number of years. It was really wonderful. So we would all experience sensors. They would open it up in a room and just people would go in there and do it. And so that was a real gift, and we thank you for that. And then it was around that time, not too much longer, that I became involved with the ILA. I had been to the conference in Chicago. I'd been to the conference in Cambridge on light, and spoke about light and syntonics. And then we heard about the ILA, the idea of it, and a bunch of us came from America, and we were just so excited to think about really rejuvenating it, because the program in England, in Cambridge, was fantastic. Primrose Cooper was one of the facilitators of that and was one of our founders here. And the problem was they ran out of money. They went bankrupt, and that's what happened in Chicago too. They had this huge program, and they just spent all their money, and there was nothing left, and they had to close it down. So we have done that. We've done well 10 years, and we have not closed down, and we just keep on going. In fact, it seems like we're making more money, so it's very good. And then we had, of course, in 2003, that's just before our conference, Marco had come and spoke to us on the outer and inner light, which you saw. Very inspiring. What a great mind. He wrote some great papers. In fact, he's got one now that summarizes his life's work, and it's called, I think, Synchronization, Coherence in Biology, and it's a wonderful paper. So at the same time, we had, right around that period, we brought Alexander Wunsch. I met him at the founding ILA. We brought him to Syntonics. He was the first physician I'd ever seen that was doing chromotherapy, which was based on Dinshaw's work, tonating the body with colored light and treating all kinds of medical problems as a family practitioner. And of course, Alexander has gone on to study light in ways that are really, really scientific and profound, and really understand the biological effects of light on many deep levels. And I'm sure he'll have published some of this stuff in the future. So I guess the next thing that got my attention a lot is we had this fella come from, he came with something called a photon stimulator, a device that had just put filters of color It's called Light Forms. They're in Arizona, and with fiber optics, they could deliver a very focalized beam of light. And they were putting it mostly on the acupuncture points and in the ear and into the body. But at that same time, Tina Kauru came and spoke to us and showed how if you use coherent light or narrowband light, at that time she thought it mostly had to be laser light, coherent, and you had all kinds of biological effects that were tapping right on the tissue and in the cells, and there was real hardcore biology of what was going on. And then Tina came and said that you didn't have to be coherent light. In fact, she was at ILA, 2 years ago, when we were in Montreal, and spoke it doesn't have to be coherent, just to be narrow band. And you have all these biological effects. So when I heard that, I thought, I had this fellow's biophoton device, photon stimulator, and I thought, well, if it doesn't have to be a laser, I can start treating all kinds of things with that. And so I started treating many different kinds of eye disease, just putting colored light in very small beams, and treating inside the eye and the macula by having them look to the side and shine it on it, dry eye, retinitis pigmentosa, glaucoma. We could lower the pressure of the eye in just seconds, putting light in certain places, so people could give up using eye drops that are very toxic. And so along with that experience, we also had a man named Ray Lazafan come, and he was the editor of the Journal for Photomedicine and Laser Surgery. And Ray and I went to one of their conferences, and we were just blown away. I mean, they had like thousands of studies. I mean, unbelievable amount of studies showing if you put light on photoacceptors, different things in the body that accept photons, you'll have all kinds of biological reactions. They're treating hundreds of conditions: wound healing, neurotoxicity, Parkinson's, Alzheimer's, trauma to the spinal cord, regenerating nerves. Anyway, it's a whole field of medicine that's opening up. It says that you have to use it, where you can measure it. So they want to put the photons in, how much it is, and then measure the biological reactions. And that's all been working out. I mean, it's all part of the picture. What they don't know is that you can put it in and affect the whole body all at once simultaneously. And so Ray and I wrote an article for them to introduce them to those ideas, and they published it. It was put it right on their front page. It was really nice. And but that's been an area now that I've moved into, and using light for other. We do syntonics in our practice. Everybody gets syntonics. Everybody looks at colored light. We've treated thousands and thousands of patients, and we've had just amazing results, and other times not so great results. All different spectrum of results. But when it works well, it is miraculous. And so we have people all day long sitting in front of our light instruments in the office with timers going off all over. This one's done, that one's done. We run probably three an hour, and it's all day long. We have people looking at colored light. And it's become so successful in my little world that the biggest insurance company in New York State has syntonics listed as an accepted vision therapy technique in their insurance, in their policies. Yeah. And just next month, one of the top medical centers in upstate New York, it's called Upstate Medical Center, that's a teaching university. They've been referring patients for brain injury to us because we do a lot of work with concussions, and we're getting such good results, and they're all doing syntonics that they've called me to come and speak, just the whole medical staff, on syntonics, because they said this is such a powerful thing, we want to learn about it. So that's really interesting that this kind of it is opening up in different ways. So there was another thing I forgot to mention that was really cool. There's a Russian technology called I don't know exactly the name of it, but it's called photo gas discharge photography, where they measure the biophotons off the hand and then through algorithms create a whole picture of all the energy in the body. And they can read all kinds of physical things, emotional things, and it creates this huge amount of information that's then transferred into all these scans of the entire body's energy. And John Downey and I were, a couple of years ago, sitting in the back of the room, and this guy's up there, Sam Byrne is up there showing these readings off of people, and you can see all their chakras, and you can see where the chakras are off and which ones are not. And it's like, can you imagine we're sitting back there and looking at chakras on the camera? I mean, what an amazing thing, this kind of transformation that's occurring.
Fantastic. Yeah.
So anyway, that was very cool. Along the same line, I've been introduced to lots of other light instruments like Carl Reiberg's monochromatic dome, the whole question of what's better now, narrow band, wide band, short treatments with narrow band, longer treatments with wide bands of color. We don't know the answers to these things, but it's really nice that all these different instruments, and you can see new sensora, new dome things from Carl's here, and all the other exhibitors out there, all new technologies that are evolving. As a result of some of this stuff, I wrote many papers. I did numbers of studies, and I was given a PhD in ocular phototherapy, which is kind of a unique thing, and that's something I've really been grateful for. Also last year, along the same line, is that, two more things. One is there's a new technology called virtual scanning that's also from Russia, where if you look at color and then you respond by trying to reproduce the color that you look at, they can read all kinds of things about your body and your physical, mental, and emotional state based on your color vision. That every single kind of physical imbalance in your body is manifested in your perception of color. And then they treat you by putting color into your eyes. So what that says is that we perceive the world because of what's going on inside of us, but then what outside of us is changing the way we perceive the world. It's a two-way. Our perception is based on what's going on inside, and yet what's inside is determining what we see out there. There's this whole unified way of reading the human body through this new technology, and it's called virtual scanning. So I went through a lot of these different kinds of learning experiences, and still don't know anything. We just keep learning and learning, and that's been the blessing and the wonder of it all, just to keep having this ability, this wonderful field where we can learn and learn. So at my present time, I moved out of energy medicine to biomechanics, and I'm working with physical therapists where they look at all the biomechanics of the body to treat. Mostly it's all rehab, sports injuries and accidents, strokes, and that the interrelationship of all the muscles in the body. I've had to study all this anatomy. It's all this hard physicality. And I want to talk about energy, and they say, oh, you can't talk about energy. We got to talk because this is the reality. And then you realize that, yeah, it's all real on all different levels, and that whatever level you're looking at. So now we're using syntonics on all the rehab patients. So I can put a colored light in front of them, and all of a sudden all the muscles are released in the chest, the breathing, the neck, and they measure it, and it's just amazing. So anyway, that's been really a lot of fun, and every month I work with them in person, and we see people, and we put colored light on them, and watch how how it releases their range of motion, all kinds of muscle groups. And then we're making those changes right then and there. So I think it's my time to step aside, and we're going to introduce Anadi.